Hi, I'm Dr. John Young, medical doctor here in Central Florida. You know, years ago, I finished my residency and everything I learned, I put into practice. But as I went further in my medical career, I realized that a lot of what they had taught me really wasn't helpful for me. I was doing a lot of work overseas with the United Nations, with mission hospitals in Africa. And I was taught in my residency algorithms. If Mrs. Jones comes in with expiratory wheezes, short of breath, there's no sign of pneumonia on the x-ray, she probably has asthma, and you do certain things. Albuterol to open up bronchial tubes, maybe some prednisone, and that's about it. And what I found is I was taught all these algorithms for what the patient presents with, their complaints, their diseases. Once I started really practicing more overseas, I realized that I was seeing stuff that the algorithms here never worked for those people over there because we didn't have those drugs or we didn't have the high-tech equipment. And so what I had to start doing was figuring out, how am I going to get these people better in the situation I'm in with them? In darkest Africa, on the Thai-Cambodia border in the middle of a war. And it was really interesting because I used all my biochemistry, my physiology, articles I'd read, old articles, and I started getting people better by just thinking what's going on with their disease, biochemistry, physiologically, pathological, anatomically, and it just completely changed how I started looking at medicine. And I really enjoyed it. I loved the hard cases. I used to hate those hard cases. You know, and I think in typical medicine today, doctors, they will go through you come in with a complaint or whatever, they do their basic things that they were taught, the algorithms. Here's the things I do. Step 1, 2, 3, 4. They come to the end of that fourth step and they're like, the patient's not better. So what do? They will send them to a specialist. You know, I can't go any further. You see the specialist. They will maybe say, well, you're depressed. Or maybe we need to see hospice. In other words, the patients were saying, but what are you going to do? Well, there's nothing else to do. And my practice of medicine is filled with the folks that failed at the general medicine doctors. In other words, they needed someone that would look at them differently and think outside the box. And it's been so rewarding because patients that I hated to deal with, I love. Example, I had a guy come in with severe COPD. You know, smoked some, but just his lungs weren't very good. Worked in an industrial area a lot. And so he saw the pulmonologist. They gave him respiratory treatments, things like that, and it made it worse. So he comes to me and I tried a couple of different things, and then I gave him some IV magnesium, and that helped more than anything else drug-wise, but he still wasn't better. And as I got talking to him and, you know, learning some things about him, found out that he used to live in Russia, and years ago he had something similar 40 years earlier, and they said it was parasites. And he brought that up, I think, to some of the doctors here, and they, oh, come on, you're here in America 40 years, you don't have parasites. Well, you know what? He wasn't getting better, he was getting worse. He was on about 150 milligrams of prednisone a day. He's weighing 300 pounds now. He's heading towards diabetes. He was a mess. So I went outside the box. I treated him with Ivermectin, a generalized anti-parasitic. Completely changed him. The guy was loaded with parasites in his lungs. That was his problem. But I had to think outside the box. Had another guy come in. His doctors had done everything. We tried some things, still not better. Said, let's think outside the box. We broke him down genetically. The neurologist said he had Lou Gehrig's disease and would given him too much B12. It was over the top on the charts. So he sent him back, said get him in a nursing home, he's going to die. Lou Gehrig's disease. We didn't agree. We broke him down genetically using 23andMe. This guy had a TCN2 genetic defect. He could not use B12. He had no B12 in his body. He had B12 in his bloodstream, but it wasn't inside the cell. We gave him adenosine hydroxy B12, and guess what? 5 weeks later, he's completely back to normal. He was going to spend the rest of his life in a nursing home for a disease that he didn't even have. It was a simple, he didn't have the right type of B12. Mayo Clinic missed it. A lot of big institutions missed it because everybody goes with these algorithms we're taught in medical school. Medical education today is teaching doctors what they should think. Think these 5 things and that's it. They are not teaching how to think. And I think that's the big problem that I see in medicine. And by thinking outside the box or really knowing some basic biochemistry, physiology, people that we were told they're useless, they'll be like that for the rest of life, it is not true. And we're going to be talking about that over the next podcast that we do. Basically this, if you're not getting better, you're going to have to go outside the box. And I'll tell you, when you do it, it really is rewarding because a vast majority of these patients get better and they get better very quickly.